Why are e-cigarettes not a safer alternative during the COVID-19 pandemic and beyond? Evidence reveals that electronic nicotine delivery systems, ENDS, and electronic non-nicotine delivery systems, more commonly referred to as e-cigarettes, are harmful to health and undoubtedly unsafe. E-cigarette emissions typically contain nicotine and other toxic substances that are harmful to both users and non-users who have been exposed to the aerosols secondhand. The use of e-cigarettes also increases the risk of heart disease and lung disorders. Given the growing evidence that e-cigarette use could be associated with lung injuries and in recent times the link to an outbreak of lung injury in the USA, described as e-cigarette or vaping product use associated lung injury, EVALI, COVID-19 may have implications for e-cigarette users. This is because the COVID-19 virus affects the respiratory tract. Further, e-cigarette use may suppress immune and inflammatory-response genes in nasal epithelial cells in a similar way to cigarette smoke, which may predispose e-cigarette users to COVID-19. The hand-to-mouth action by e-cigarette users may also put them at increased risk of contracting the disease. If e-cigarette devices are shared, the risk of transmission is also likely to be increased. Given that some countries are in lockdown and access to e-cigarettes may be limited, especially for youth, the sharing of devices may be more common under these circumstances. In addition, the scientific evidence regarding the effectiveness of ENDS as smoking cessation aid is still being debated. To date, in part due to the diversity of ENDS products and the low certainty surrounding many studies, the potential for ENDS to play a role as a population-level tobacco cessation intervention is unclear. Tobacco users should quit completely and not switch to e-cigarettes, which pose health risks of their own and are not safe. The safest approach is not to use either tobacco products or e-cigarettes. Using any of these products may increase the risk of COVID-19 patients suffering more severe illness. Tobacco users who want to quit should use tried and tested interventions such as brief advice from health professionals and national quit lines or cessation interventions delivered via mobile text message, i.e. cessation for tobacco cessation, where available. That's it for this video. Make sure to like, subscribe, and share it with a friend if you found this useful.